and you mark out the medial limbus, where the colored portion meets the sclera. That's pretty much where the supraorbital, but it's going to emerge there, and you can often feel, I think she has a notch, and it's going to travel north, because what the supraorbital artery wants to do is give off branches and feed the periosteum, the muscle, and the subcutaneous tissue of the forehead. That's its job. You just bring this crease over here, and the first crease, we used to think the artery was always behind the crease, but it's probably 1 or 2 millimeters to the medial or lateral aspect now that we know. But if you bring that crease together and make a little mark, you have a pretty good idea of where the supratrochlear artery is, but that also is going to travel north, and it too is like the cavalry bringing blood supply to the periosteum, the muscle, skin, and subcutaneous tissues of the forehead. We know where the arteries emerge. We know where they want to go. But what don't I know? There's a lot of things I don't know. But in regards to this, what I don't know is how they get there. So we know that the arteries have to be deep there. They're terminal branches of the ophthalmic artery. They come from the internal carotid system. They're coming out of the skull. They can only be deep here. We also know that they need to get superficial because that's their task, is to feed this area. And we also know, thanks to large cadaver studies, a more recent study was Leone, I think, and Sebastian and some others using ultrasound CT-guided imaging, and they found that there is a distance above where the arteries emerge by which there are no large branches on the bone. I like to go just about 2 centimeters just for safety's sake. And I will mark that out on my patients. So I like to be sure. I know that they're deep here, they're superficial here, not on the bone, but I don't know how they got there. I don't know if this artery popped up and traveled superficially. I don't know if it stayed deep and then popped up. I don't know if it took a meandering course, but I really don't care because this is going to be my no-fly zone. I won't go there with a needle, and I won't go there with a cannula. I know that if I am deep on the bone, above 1.7 centimeters, there should be no significant vessels of size.